What does it take to become a board certified endodontist? What is your residency training program like? Actually, before the residency program, how do you apply for endo? And then once your residency is done, what is a typical day like? What are some projects? What kind of research? What kind of things will you be doing? What are the challenges of being an endodontist? Stay tuned as we talk about becoming an endodontist and then life after residency with a board certified endodontist who will share all of the information about becoming an endodontist. Stay tuned. Hey, this is Dr. Darwin, new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into dental residency, and then life as a new dentist. Guys, be sure that you are continuing to share, comment, like, and also subscribe to these episodes and to our channel. All right. Um, the information that we share to you is important for us to be able to share this information, but also it's important that you share it with others as well, especially those that you feel that it would be helpful. All right. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidencyChallenge.com, the ultimate resource that helps you jumpstart your candidacy so that you are ready and getting into the residency program of your dreams. For more details, check out the link down below. All right, special guest today. Um, Something in common. We have a love for one of the procedures that other people may not love, which is called root canals. Uh, but also we special connection of both of us going to the first dental school on the planet, right? Today we're
Right.
joined with board certified. I think board certified, right? I've been
I
saying
am,
board certified.
yes.
Yep,
Yes.
yep. See, I know it. I know how to. I know how us University of Maryland folks how we roll. All right,
Right.
board certified endodontist, Dr. Valerie and Doc. How you doing?
I'm doing good. Thank you. Thanks for having me.
Yeah, absolutely. Thanks for taking some time out of your busy schedule so we could talk about careers in dentistry related to specializing in endo. For
Sure.
many who are meeting you for the first time, please continue to tell us more about yourself, where you're from, your background, and where you're located now.
Sure, sure. Hello, everyone. I'm Dr. Valerie Okihi. I am Nigerian. I was born and raised in Nigeria, came to the United States as a teenager. I guess Maryland is my home now. I completed high school here in Maryland. I went to University of Maryland, College Park for my college training. And after that, I did dental school in Maryland as well. Of course, like Dr. Hayes said, the first dental school in the world. We're very proud of that. I graduated from Maryland in 2009. And then I did a GPR in New York for 1 year. After that, I came back to Maryland and practiced as a general dentist for about 2 years before going to Houston, where I completed my endodontic training. So I was in Houston from about 2012 to 2015, graduated in 2015, and then I returned to Maryland where I am now practicing endodontics. I started out as an associate. I worked as an associate for 3 years, and then I opened my own practice in 2018. So this year will be year 7 for me. Another thing that just happened recently is I acquired my second practice this year, just about a month ago. So that's been going well. But yeah, so now we have 2 locations, and just working out of those 2 locations. Yeah.
Awesome, awesome. And we're going to get to that part of your journey of becoming a practice owner two times, meaning with two or one or two or more, multiple offices,
Oh,
because that's a journey too in itself,
it
right?
is. Yes, definitely.
A journey that most of us, if not all of us, don't get any training
That is
uh,
true.
during dental school about how to be dental entrepreneurs, right?
Right, right. Yeah.
But that's another discussion for another day. So let's
Hmm.
jump in. Endo. What
Hmm.
about endo was
Hmm.
appealing to you to the point where you were like, you know what? I'm not taking out these teeth. I'm not doing no
Hmm.
dentures. I'm not placing no implants. As a matter of fact, I'm not doing any more fillings. I'm not doing no more crowns.
Right.
I'm doing endo. Why
Yeah.
endo? Why did you decide to do endo?
Very good question. When I started dental school, I actually thought I would go into orthodontics because ortho was sort of my first exposure to dentistry. When I came to the United States, I requested braces because I didn't like the gaps in my teeth. And so I started orthodontic treatment soon after I came to the US. And it was my orthodontist who recommended that I explore dentistry. So that was my first introduction to dentistry. And that was coming from someone who I felt like I could relate to, someone who looks like me. And so it definitely sparked that interest. So that is why I decided to go into dentistry. And of course, with time, I continued to research dentistry applied and I got into Maryland. Now, while I was in Maryland, we had to do different rotations during our second year. And I found that of all the different rotations, we went through oral surgery, ortho department, pediatrics. But the one rotation that gave me the most fulfillment was the urgent care rotation because, during that rotation, we came across or we interacted with a lot of patients who were in a lot of pain. And when patients are in pain, when anyone is in pain, it's just very interesting how it really changes your whole life and your outlook on life. They're so distraught, just not themselves. And then, of course, in urgent care rotation, we had to just get them out of pain, do emergency treatments like pulpotomies, and then they are scheduled to return on a later date for completion of treatment. When they return, they're like completely different people. They're happy, they're so grateful, and you just watch that and you see how much tooth pain, can really interrupt your life, and just being able to take patients out of pain or get them out of pain, and watch them return to their normal lives. There's just something very fulfilling about that. So that's what really drew me into the field of endodontics.
Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. And that's interesting that you mentioned that pathway to endo did not start with endo. It started with ortho,
Mm-hmm. Mm-hmm.
right?
Mm-hmm. Yeah.
As an introduction to dentistry.
Uh-huh.
Um, and I'm glad you brought that up because for people who are listening and watching, they need to know that just because you may not know you want to specialize, or just because you do know you want to specialize and you pick that discipline,
Mm-hmm.
does not mean that it can't change or won't change,
Exactly.
right?
Exactly.
So keep hope alive, meaning
Mm-hmm.
it's okay that you have rotations and and through those rotations you may explore other
Exactly.
things that you really want to focus in, or in this case want to specialize in. Um
Right.
so
Yeah.
so that's okay. But as soon as you do decide, you
Mm-hmm.
gotta move quickly to start
Yes.
to develop your candidacy, which I want to talk about next,
Mm-hmm.
because there was a period of at least 3 years,
Mm-hmm.
at least from the time that you realized endo,
Mm-hmm.
graduating from dental school, doing a
Mm-hmm.
GPR for a year, working in private practice for two. There was at
Mm-hmm.
least 3, maybe 4 years before you actually um, got into endo and started
Right.
your endo training.
Mm-hmm.
Tell us a little bit about those years as it relates to you preparing your
Mm-hmm.
candidacy for endo. Meaning, what were some of the things that you did as soon as you knew in those rotations at Maryland,
Mm-hmm.
those urgent care rotations, from the time that you knew that that urgent care would now translate to wanting to do endo, from
Mm-hmm.
that time all the way through 4 years later or 3 years later,
Mm-hmm.
that you actually are applying or getting ready to apply to endo?
Mm-hmm. Well, to tell you the truth, when I graduated from dental school, I really didn't want to do too much more training. I just wanted to get out there and work. So there was this noise in my head that, you want to do this, but I didn't want to commit to it. And so after my GPR, I convinced myself that I could just do a GPR and just get really good at endo and just be a general dentist who does a ton of endo. I explored that, and that's what I set out to do. After GPR, I came back, practiced for about 2 years, and I just could not quiet that voice in my head that kept saying, "You don't really want to do anything else but endo." So during that time, I started to prepare my application packet. Um, one thing I would say is I was never a 4.0 GPA student, but that didn't deter me. I always knew that, a great candidate is a candidate who is not necessarily one dimensional. You may not have that 4.0 GPA, but maybe, there's something else that that you stands out about you, or sets you apart from the pack. For me, I took advantage of the fact that I was in private practice, so that gave me a lot of clinical experience. So I tried to just focus on endo cases while I was in private practice. For some others, it could be a GPR, but just something else. I did also shadow an endodontist during that time, just to show that I'm interested, and that I am passionate about the field and I have genuine interest in the field. So I did that. I just try to get involved in different areas that can, show me as a well-rounded candidate, basically. Yeah. So I think definitely having that clinical experience really offset the fact that I didn't have a 4.0 GPA. And shadowing endodontists, going to the annual conference that would show any program chair that you do have that genuine interest. So those are the things that I tried to do as I was preparing my application package.
And when you mentioned going to the annual conference, that's AAE for those
Mm-hmm.
that are listening. What was why do you think that was key? In addition to probably meeting some program directors that were there, why else is that an important endeavor and
Mhm.
thing to do as an endo candidate?
I think just being in the presence of other people who are where you're trying to get to, you could learn a lot more from other current residents, people who are maybe just a year removed from you. Being around the program chairs, the directors, seeing what they're looking for, hearing from current residents what their programs are like. I think it's definitely was is a very informative it was very informative for me to help me make a decision or to kind of make me more convinced that this is what I want to do, as well as gather information about how I can strengthen my application profile.
Yeah,
Yeah.
those things are key.
Hmm.
Um, and they're also key to go to that meeting so that people see you,
Yeah.
right?
Hmm.
People
Hmm.
see you and you can be seen,
Hmm.
especially before your
Hmm.
application hits their desk or hits their
Right.
inbox or hits the
Right.
portal, right? The pass portal. Um,
Yes. Yes.
very, very important things. So let's
Hmm.
talk about
Hmm.
your residency training overall.
Hmm.
Share with us some highlights about uh, endo at UT Houston,
Hmm.
University of Texas Houston Endo program, as far
Yeah.
as how many residents they take, what maybe what
Hmm.
they're known for, or what their strengths, things that you like the most, some
Yeah.
things that
Yeah.
were kind of challenging about the program,
Yeah.
or or if it wasn't necessarily challenging about the program, just challenging
Hmm.
about the discipline as you were
Right.
training.
Hmm. Yeah. So at the time when I was in Houston, it was a 3-year program, a 3-year, two resident program. During my third year, it was converted to a 26-month, four resident program. But yeah, I had one co-resident. It was just him and I. I would say that it was an intense program in the sense that there was a lot of focus on literature, understanding the history of endodontics, as well as just a lot of exposure to different types of cases. In that sense, it was a very comprehensive program. Lots of reading, lots of presentations. My program director was Dr. Samuel Dorn, and he set the bar high for us. He's very, very literature driven. He really believed in all his residents becoming board certified as soon as they graduated. So, based on that, he set out to prepare us during those 3 years. So, it was good for us. In those 3 years, it was a lot of, it was a lot of research, presentations, um, reading, doing as many cases as possible. But, I did become board certified when I graduated. So I guess it did work out. That's exactly what he wanted, and that is why he kind of did the program the way that he did. Yeah.
Now, when you say board certified, was that directly after graduation? Because
Um,
because most people, well, it's known that in order to complete the program, there's two steps to certification, right? There's the being board eligible, part of which is maybe like the first part of an exam,
right. Yeah.
your training as a resident, and then there's another step, which is maybe another exam with some clinical cases that you may have to present.
Yes. Yes.
So
Yes.
when you say upon graduation you were board certified at UT, is it such that part of the curriculum is not only for you to be board eligible, but within the curriculum, like maybe a month after graduating, you guys take the exam for certification. Share a little bit
Something,
about that.
yes, yes. So you're absolutely correct. There are three stages to becoming board certified in endodontics. The first stage is just a written exam. So we do that exam is administered while we are still in residency. And then the second stage would be you can do it in whichever order. There is an oral exam and then there is a case portfolio. The cases, you have to have about 10 cases. I don't know if the number has changed now, but you do have to have a 1 year recall and they do have to meet certain standards. The toughest part is the oral examination. So that's the part that we prepare for. That's the part that is the most intensive because you are being examined by three already board certified endodontists and they can ask you all kinds of questions and your answers have to be supported by literature. So you have to be very well versed with the literature. And so what I meant is that the entire program is designed to ensure that you understand as much literature as possible and that you are exposed to as many different kinds of cases as possible so that no matter what question comes up during your oral exam, you're able to answer it accurately and have your answers supported by literature. So in that sense, there was a ton of literature reviews that we did during those 3 years, and I think that he did achieve his goal in the sense that most of us who graduated from that program were very comfortable with literature and being able to defend our positions on, you know, during the oral exam.
Gotcha. So, just as a recap, it was a 3-year program that turned into a
Yes,
26-month program,
yes, it is now a 26-month program, I believe.
and they
Yes.
take two residents per year or more.
At that time, when it was a 3 year program, it was two residents per year. When it became a 26-month program, they also increased the number of residents that they accept. So I believe it's four now.
Oh, wow. Okay, almost doubled
Yes. Yes.
per year.
Mm-hmm.
Gotcha. Um,
Yeah.
as a part of the program, what did you like the most?
So I just really enjoyed the amount of exposure that we had to different kinds of cases. Our program really accepted a lot of low income patients and patients who couldn't really afford treatment elsewhere. So, we had all kinds of cases. We had surgical cases that you wouldn't necessarily come across in private practice, revascularization, just cool things like extracting teeth and replanting them. But that's I would say that the clinical aspect of the training is what I really enjoyed most because I just it's like you're a kid in a candy store. I was just able to try as many different cases as I could and get really good and hone my skills. Yeah.
There are some programs that are teaching some other related modalities as part of the
Hmm.
residency training, and
Hmm.
that is implants. Did you guys do any implants?
We did not. We did
Okay.
not. Yeah. So that's very interesting. I wonder how that's going. But I have had a few people ask me if I place implants, and I don't.
Right, right.
Yeah.
Well, now speaking about something that you don't do, what did you not like, or
Mhm.
should I say, what were some of the most challenging parts of residency training for endo for you?
The only thing I can think of really is just being away from my support system, I would say, because I was there for 3 years. Just I mean, the only thing that took me to Houston was my residency program. I didn't have like family there, and it's a 3 year program. 3 years is a long time. During those 3 years, I dated my husband, then we became engaged, and then we got married during that 3 year program. So it's a long time. But the program was great. It's just it was challenging to be away from family and my support system for
Yeah,
that long. Yeah.
that's always that's
Yeah.
always a challenge. Speaking about family,
Mm.
usually folks will uh, launch their once they've kind of launched their careers, then they will launch their family, but they will also launch what we call their other components of their family, meaning
Uh-huh.
babies, like
Yeah,
becoming a practice owner, like fulfilling their
yeah,
dream of having owning their own practice.
right.
And I know you shared earlier that you are just recently have a second practice that you opened up. Let's talk a
Yes.
little bit about your work experiences. What your day to
Mm-hmm.
day is like, both as as an owner,
Mm-hmm.
and also as a provider, but also as an owner who now has multiple locations. Share with us how your typical day, what it looks like.
Mm-hmm. Yeah, so I work, our office is open 8 to 4 every day, Monday through Fridays. We're closed on weekends. And so my typical day, really, I start seeing patients at 8 a.m. I do about 5 to 8 cases depending on the day. And I do about 4 consults. I try to, organize my schedule in such a way that I have enough time with my patients. So my treatments are booked per 90 minutes, right? So in addition to that, my typical caseload. Sometimes we may have emergencies added to our schedule. The great thing about endodontics is a lot of us endodontists, we have really great relationships with our referring dentist. So they can call us up anytime. Hey, I have a patient in the chair. I'm not able to numb this patient, or I'm having an emergency. Can we send the patient over? That's what we're supposed to. That's why we're there to help out the dentist when they're in a bind. And so a typical low stress day could become hectic if you get maybe 2 or 3 of those emergencies added to your schedule. But that's pretty much it, just doing cases between the actual root canals and consults. And of course, the work never stops as an owner, because there's also some management stuff that goes on behind the scenes. Just making sure there's certain things that, outside of the clinical aspect of endodontics that need to be taken care of so that the office continues to run smoothly. But that's pretty much it for the most part. Just seeing patients between 8 a.m. to 4 p.m. And yeah.
Now, do you have call? You take call within any emergencies? How's that set up? How do you have that set up currently?
So right now, our referring dentists know that they can they can call our office at any time when they have an emergency, and we are always able to add the patients to the schedule. Even if we're not able to complete the treatment, at least get the patient out of pain. Um, we do have staff that have extended hours, and so we are able to take calls as late as 6 p.m. Outside of that, then the calls go to our emergency line, and I usually am the one to answer those after hours. We always make sure we're available to our patients, even on the weekends, just in case maybe there may be a question, or a lot of times if we're not able to come into the office, then we may refer the patient to the ER, like on a weekend. But we do have those extended hours to make sure that there's enough coverage for the patients, for the majority of the day.
Which procedures, of course, root canal, but
Mm-hmm,
which teeth or what types of conditions are you finding procedural wise? Are you
mm-hmm,
finding you're getting referred to the most? Like which are they retreatments? Are they stuck dislodged or fractured files in the
mm-hmm,
canal? Are they uh cases where they have a failure to heal,
mm-hmm,
missed canals? Like what are or are they second or third, maybe some third molars? Like what are some of the top two or three procedures or situations that you're
mm-hmm.
getting referred, cases are being referred to you for?
Yeah, I would say generally just molar root canals in general. Molars. I find
First
that
molars too?
I think so. Yeah, yeah, yeah. So, but again, it depends. So, each dentist is different. So, some dentists are braver and they are able to take on a lot more challenging cases. So, we may have some dentists that refer strictly just retreatments because they can handle everything else. There are still some dentists who want nothing to do with the root canals, any root canals. And so they send all of them. But I find most dentists are comfortable these days doing the anterior teeth and the premolars, and then they send off the molars. Some of them will even do the first molars and send out the second molars. Most dentists are still referring retreatments. I think that I don't see a lot of general dentists who are doing their retreatments. So I would say the most commonly referred teeth would be probably first and second molar root canals. Yeah.
And are you also getting requests to assist general dentists or maybe even pediatric dentists who do some of their own endo for whatever
Mhm.
cases? Are you getting requests um, for you to share your expertise, meaning CE, continuing education, tips, tricks, strategies, things that as an endodontist you can
Mhm.
share with GPs who are not
Oh yeah.
endodontists, but who may be endodontic enthusiasts. At least
Mhm.
we
Mhm.
think we are until we got,
Yeah.
at least we think we are until we got to call you, right?
Yeah, oh no, definitely all the time. I have great relationships, personal relationships with my referring dentist. So I always get, questions about like more effective numbing techniques because sometimes a dentist may actually refer a case because they're not able to get the patient numb. I'm always happy to share my tricks for like navigating separated instruments or navigating like the molars with the MB2 canals and yeah, things like that. Sometimes I even have my colleagues come over to shadow. Yeah, so I get those requests sometimes, and we're always able to accommodate. The general dentist. Sometimes it just takes looking at the endodontist and seeing how they're doing the work. Yeah, so um, I'm always open to sharing any tips and tricks that I can with general dentists because I think it's important. It's good for a general dentist to be empowered to do the cases that they feel comfortable doing, and then refer the ones that they kind of feel is out of their scope.
When you're talking to general dentists, what is one sentence or a collection of sentences that you constantly find yourself saying to us as general, as from practitioner to practitioner related to endo?
Mm-hmm, mm-hmm,
Um, I mean, outside of maybe some follow-up stuff that we get, of course, that that it's told to the patient. But I'm curious
mm-hmm.
as to, as a board certified endodontist, what are some of the things that you find as part of your normal conversation with referring dentists?
Huh.
Or as you're thinking about that, what
Mm-hmm,
is something that you commonly tell patients
mm-hmm,
who have just recently completed or maybe not completed root
mm-hmm.
canal therapy because you weren't able because their canal
Yeah.
was closed or
Mm-hmm.
occluded or calcified. What's the same thing, the most popular thing that you're constantly saying to patients about their treatment?
Mm-hmm. Yeah, so I think one thing that I notice is a lot of patients after their root canal, once they're out of pain, they sometimes just kind of forget about the next step, which is to return to their general dentist for permanent restoration of the tooth. So one thing that I know I'm always talking to my patients about is please return to your general dentist for permanent restoration of this tooth. And even during the consultation visit, I let my patients know and make sure they understand that the permanent restorative part of the permanent restoration part of your treatment is it goes hand in hand with the endodontic treatment. So if you think that you will not follow through with returning to your dentist to restore this tooth or put a full crown on it, you may want to reconsider whether you want to proceed with the root canal because it might fail if you don't do that other part. I think it's very important for patients to know that these two go hand in hand. So there we get some patients who complete their root canal, they return in about 6 months, they still have the temper filling in the tooth, and now they're having symptoms and they're wondering why did you do a root canal and now I'm still having pain? Or now I developed pain recently. I thought that you've already done the root canal. I thought that I could never have pain in
Right.
this tooth. And
Dr.
so,
Valerie didn't do it right.
yeah,
Uh, right. It's all
yeah,
that's all our fault all of a sudden
mhm.
because they forgot or they
Yeah,
didn't didn't follow
hmm,
instructions, right?
yeah, yeah,
You caused
yeah.
this pain. I was in
Hmm.
no pain before. Yeah, well, absolutely. But
Yeah,
now you're being now you yourself are causing the pain because you're not following instructions, right?
yeah.
Yeah, so just that sounds consistent, telling
Hmm.
individuals, hey, the root canal, the disinfection of the tooth and all the
Hmm.
infection that was inside of it, doing that is only the first step.
Exactly.
There are
Exactly.
two
Yeah.
steps.
Hmm.
There are
Yeah.
two steps.
Yeah,
So,
yeah.
yeah,
And that's
that's
something we have to keep repeating to them. We have it in the post-op letter that we give to them. We verbalize it. We give them a written copy. But, sometimes, once you're out of pain, you just kind of move on with life. And yeah, until you're reminded that, hey, you know, you forgot that other part. And now the pain is returned. Yeah.
right, right.
Hmm.
Um, Speaking about pain, for candidates who are applying or getting their getting their
Hmm.
applications together,
Hmm.
uh, that can be a pain for people, right?
Yeah, yeah,
It can
yeah.
hurt in not just their mouth, but their whole body, the whole
Right.
psyche, the whole
Yes,
psyche as well.
yes, yes.
What are some of the things that you feel makes a good candidate for endo residency in such that they will stand out
Mhm.
amongst all of the hundreds of other candidates that are applying and also stand out in front of the selection committee? What are some of those things that make a good candidate for endo?
So I think, just like you mentioned, there has to be something that separates a candidate from the pack. Most people who are applying to endodontic residency are probably going to have very good grades. And so we want to add to that. I would definitely say try to shadow an endodontist or speak to an endodontist, just show some interest beyond the desire to go to endo residency, um, visit an endodontist office and maybe shadow them for a day or two. Definitely, I think that some programs do like when you have experience in research. Or maybe you have clinical experience, like I mentioned in my case. I was able to work in private practice for 2 years, so I just took advantage of that and just built up my clinical skills when it comes to endo. So generally speaking, I would say that an overall well-rounded candidate is what most of these programs may be looking for. And of course, a way to kind of show that desire and the genuine interest in the field of endodontics, like I mentioned earlier, attending something like the AE conference will kind of show that you are genuinely interested in the field. Um, but I would say things like that would definitely boost your chances of you know, at least maybe getting into the program or at least, getting some interviews to the
Yeah, you
program.
got to get those interviews. Yeah,
Hmm.
yeah, because
Yeah.
you don't get into the program until you have an interview.
Yeah. Yeah.
What about a portfolio? What in your experiences with other colleagues, um,
Hmm.
either during your journey or just in general,
Hmm.
what have you found related to the thought of putting together an endo portfolio, right? Especially if you've been
Hmm.
working on some
Hmm.
cases or you've just been having, 2 or 3 years of clinical
Hmm.
experiences where you're doing maybe some more endo. Maybe you're the general dentist in the office that everyone sends their endo to.
Hmm.
Do you,
Hmm.
what are your feelings about procuring and developing
Yeah.
a endo portfolio as part of your candidacy as well?
I think that's a great idea. I mean, it's a way to kind of show what you've been doing and show your skills, advertise your skills. It's kind of like when we do the case presentations for our board certification, you have to present cases. So I think that it definitely is attractive to these programs when they see the work that you've been doing. It doesn't have to be excellent work, but the fact that you're kind of venturing into that space. I think that that's a really great thing to have, definitely. I
What?
was
Oh, go ahead.
advised to have one when I was applying, so I would definitely recommend that.
What about the fact that there are some endo programs that require another exam, meaning the ADAT, the ADAT? Do you think generally candidates should consider taking that, even though not all the programs require it? What are your
Oh
thoughts
wow.
about that? Because I'm not sure if UT Houston, if that's a program that require the ADAT,
Hmm.
but there are some programs that do require it.
I see. To get into the endo residency programs, huh? Oh wow.
Yeah,
Yeah.
that's uh one of the factors that determines how many programs some folks will
Oh,
apply to, because
yeah.
there are some requirements, there are some programs that
Hmm.
list that as
Hmm.
a non-optional
Yeah,
requirement.
yeah, unfortunately. Yeah. So the way I look at it is when I was applying, I knew my goal was to become an endodontist. And then it just came down to figuring out how to get there and whether I have to jump through hoops. So you just have to look at it that way. You look at the programs, how many programs are there. I tried to apply to a certain number that I felt like would give me a great chance of getting into at least a couple. And then you look at the requirements for each program and see, are these requirements that I can meet? And then you try to just kind of sort it out. If it's just not a requirement you can meet, then that program gets dropped. But again, if my goal is I need to get in this year, like I don't want to wait another year. I want to maximize my chance of getting in this year. Then I may consider doing whatever it takes and be trying to do what I can to meet all those requirements. I honestly didn't even know that some programs are requiring this now, but it unfortunately is going to be a deterrent for some candidates. But that's just the way it is, unfortunately. It
Yep.
just depends on whether you want to get in right now or you want to take the chance of maybe eliminating those ones that have that requirement and seeing what happens.
Yeah, and it's a key thing for those of you that are listening, watching, especially as it relates to endo, which I think it you probably is probably the reason why you're listening and watching, because you're interested in
Hmm.
endo. But
Hmm.
knowing that that's a strategy too, meaning
Hmm.
you strategically afford yourself a larger pool to jump in,
Hmm.
to get
Hmm.
attention, and get
Yeah.
recognized, to get to the interview based
Yeah.
on those programs that
Hmm.
require
Hmm.
the ADAT or any other certain
Yeah.
requirements, right? Just like for ortho, requirement for most programs is taking the GRE,
Uh-huh. Uh-huh.
right?
Yeah.
Just like
Yeah.
for oral surgery, you have to um, take the step one
Hmm.
portion of the medical
Yeah.
boards
Yeah.
that's
Yeah.
now been tailored specifically for
Hmm.
oral maxillofacial surgery
Hmm.
candidates as well. So keep that in mind. Do you have to do it? No, but you also want to make sure that you're being strategically
Hmm.
sound and making sure that you give yourself the best opportunity to get recognized. Because guess what?
Right.
None of these programs right now know who you are unless you've been
Hmm.
to the meeting or went to the meeting last year and you're planning on going this year, or you met people
Uh-huh.
last year. They don't know. You're in obscurity. So your job is to get their attention, and
Right.
one of the ways to get them attention, in addition to what you shared as far as shadowing and visiting um, not only endodontists, but maybe even doing that with programs. Another
Hmm.
way to get their attention is taking the
Yeah.
ADAT
Yes. Yeah.
for those programs that require it, right?
Mm-hmm.
Even some of the programs that don't require it, if you put
Mm-hmm.
that in your application, that may stand out as well,
Yep.
right?
I agree. I agree.
So I just wanted to share that because that's something common that we get all the time. A question that we get from colleagues about, should I take it? Should I take it? Should I take
Mm-hmm.
it?
Mm-hmm.
And our answer typically is always, you should do the things that gets you the
Mm-hmm.
most attention, that you
Exactly.
get the most looks and opportunity for you to
Mm-hmm.
get more invitations
Yes.
to get
Yes.
interviews,
Exactly. Exactly.
whatever that is. So
Mm-hmm.
that's key. Next, we want to know whatever it is related to tips, advice, knowing what
Mm-hmm.
you know now and your
Mm-hmm.
journey, starting kind of like thinking dentistry via ortho, and then
Mm-hmm.
flipping through some experiences into from dental school into endo, and then working, having experiences and GPR resident and working in
Uh-huh.
private practice doing more endo. Um,
Mm-hmm.
Kind of like that being the launch pad of your journey, knowing what you know now and everything that you did leading
Mm-hmm.
up to where you are now as a two office business owner.
Mm-hmm.
What are some tips that candidates who are listening and watching right now, some tips and advice that you feel they must do
Mm-hmm.
en route to becoming a board certified endodontist? What are some of those things that they must do right now?
Mm-hmm. So I think definitely you want to prepare a strong application package that stands out from the pack. A lot of people are applying to the residency program, whether it's endo or ortho, whichever, but there's competition. So that is the number one thing, to understand that there is competition and to figure out a way to separate yourself from the pack. For some, it might be that you have the highest GPA in the class. For some others, it may be that okay, I have clinical experience. I've been doing endo as a general dentist for about 5 years or so. So then you want to make sure that that grabs the attention of the programs. So whether it is, like you mentioned, by presenting a portfolio or speaking about that in your personal statement or during your interviews, but you want to definitely present yourself as someone who hasn't only just done 4 root canals, which was a requirement for your graduation. I would say preparing a strong personal statement, that's your opportunity to show the program who you are, and why, and to demonstrate your passion and interest. So I think that counts for a lot. um, Letters of recommendation from faculty that can speak to your clinical skills, maybe faculty that you worked with in dental school, or maybe your GPR or AEGD programs. People that can speak to your clinical skills, your work ethics, your character. I think that those are just some tips I would give. Finally, just relax and be yourself during the day of the interview. I know it's easier said than done, but I think the programs, they kind of want to know who you really are. And a lot of times we get so stressed about the entire process, leading up to the interview, that we're just such a nervous wreck on the day of the interview that we're not able to kind of convey who we are. But yeah, I think if I if I look back, I probably should have been just more relaxed and just kind of enjoy the process some more, because it is stressful for us as we go through it. But you know, I think it would probably if I had to do it again, I would be more relaxed, and I would just try to appreciate and enjoy that process. Yeah.
Now, when you say be more relaxed, what do you because people hear that, they're like, okay, it's easy for her to say, but it may not be easy to do. Like, relax how? Like being more
So,
comfortable, being in a situation where you don't know people and you have to talk?
mhm.
Like, what what do you think could have relaxed you more during those times of the interviews?
I think probably it's a mindset thing. I think the mindset that I had going in is like a lot was riding on this, and it had to go well. And you put so much pressure on yourself that you kind of you miss the moments. So when you have that in your mind, you may not have relaxed conversations, that allow people to get to know who you are, and maybe they can discover that, oh, this will be a great asset to our team. Sometimes, these directors, that's why part of the interview process is having you interact with other residents, current residents. Are you a team member? Are you a good team member? Like there are other things that are being assessed other than your clinical skills and how your GPA and how well you did in the didactic aspect of your training. Are you a good fit for the team? Things like that. But it's a small part of it, but I think that a lot of us get so worked up with that entire
Yes,
process that
yes,
it's just like a ball of nerves on that day of the interview.
yeah. And quite honestly, I think you hit it right on the head. You said uh mindset management. And the only way you
Mm-hmm.
can manage your mindset is you've got to be motivated to be
Mm-hmm.
comfortable talking
Yeah.
and having a conversation with strangers.
Mm-hmm.
But
Mm-hmm.
more importantly, like you said, just be in the moment. Be comfortable being in moments where you may not know everyone, but you look
Yeah,
for the opportunity
exactly.
to share more about yourself, but also to be interested in
Yes.
those that you're talking to, right?
Yes.
Take
Yeah.
the pressure off yourself, so to speak,
Mm-hmm.
making
Mm-hmm.
sure that you have questions, that you're
Yes.
asking questions so that
Yes.
you don't feel like you're the only one answering questions,
Right.
right?
Right.
Ask
Uh-huh.
questions, have those questions
Exactly.
ready to ask so that you are
Mm-hmm.
facilitating and also contributing to the conversation
Exactly.
by just not answering the questions
Mm-hmm.
like you're in the
Yeah.
courtroom or something like that,
Yeah.
right?
Yes.
So having that mindset, knowing that yes, it's important, but every minute and every opportunity where you breathe oxygen is important.
Uh-huh.
So
Exactly.
you already know that. So you already know that this
Exactly.
situation is important.
Exactly.
Yes. So what can I do to make the best of today,
Uh-huh.
being that this is all I have. This is all I can do on this day.
Yes.
And part of the process is that journey, right? Having that
Yes.
type of mindset. And that may take some practice.
Mm-hmm.
Definitely
Yeah.
will take some practice
Mm-hmm.
um to develop that type of mindset, which is
Yes.
another reason why you must prepare
Exactly.
for that day, that opportunity, right? Piss poor preparation promotes piss poor performance. There's
Mm-hmm.
no
Mm-hmm.
time for piss poor. As dentists, we know we can't be piss poor. That's not
Right.
part of our that's not part of our DNA, right?
No, no.
Especially where we're type A. It's definitely
Right,
not
I
part of our
know.
DNA. So you just
Yeah.
have to practice. You have to
Mm-hmm.
practice talking, feeling
Yeah.
comfortable talking to people, finding
Yeah.
things to talk about with
Mm-hmm.
those that you're going to be presented to
Exactly.
during the interview. And know
Yeah.
this, the interview is just a conversation.
It's just a conversation.
That's all it is. It's an
We don't want to
opportunity.
overthink it.
No, don't overthink it, right? It's not an oral
Yeah.
exam. It's just
Yeah.
a conversation,
Right.
you know? It's a conversation. And I will
Yeah.
say that this conversation has been very helpful. Doc, if
Mm-hmm.
people want to talk with you some more about
Mm-hmm.
endo or becoming a practice owner, what's the best way
Mm-hmm.
for people to connect with you?
So I am on Instagram. My handle is at root canal dr. Yes. Yeah. Yeah. And okay, so and I guess you could also reach me on my office phone. It's 240-219-9010. But I know everyone is on social media now, so I'm there too. Um, probably the easiest way to reach me would be on social media. Our website is www.eliterootcanal.com. So yeah.
Sounds good. So Instagram and website here. Perfect. Perfect. Well, Doc, this has been a perfect opportunity for those who are interested in endo to hear more about your journey. You hear more about why endo for you, which may be something similar for people that are listening and watching, the preparations that you took, what your program is like or was like at UT Houston, some of the things that you really like, some strengths, some highlights, and learning more about what makes a good endo candidate, right? And then also getting those tips and advice from you, knowing what you know now, what you've experienced as a candidate, but also as a board certified endodontist for the last 10 years. So this has been great. So thanks so much. And there's more greatness. There's more greatness. You gotta go to the next episode. Go to the next episode for more greatness. Go, go, go.
This was fun.